be demonstrating the different positions of the body. I am the commentator.
I'm the patient.
Thank you. The first position we will be demonstrating today is the supine position. It is used for examination or treatment of the front or anterior part of the body. As you can see, our patient lies flat on his back, as shown here. The arms are flat at the side of the body, make sure they're flat, and a draping pillow can be used in this type of examination. The next position is the prone position. It is used for examination or treatment of the back or spine. As you can see, our patient lies on the abdomen and turns his head to either side. The arms can be flexed at the elbow and positioned on either side of the head or along the side of the body, but as you can see, our patient here it's flexed at the elbow near his head, and a drape can be used. The next position is the Sims or left lateral position. It is used for simple rectal exams, enemas, rectal temperatures, and treatments. The patient lies on his left side. The left arm is extended behind the back, as shown here. Head is turned to the side. The right arm is in front of the patient and the elbow is bent. The left leg is bent. The right leg is bent sharply and brought up to the abdomen, and a draping and pillow can be used. Our next position is the knee to chest position. It is used for rectal exams, usually a sigmoidoscopic one. The patient rests the body weight on the knees and chest. Arms are flexed slightly at the elbows and extended above the head, as shown here by our patient. The knees are slightly separated and the thighs are at 90-degree angles or right angles to the table. As you can see here, it's 90 degrees. And draping can be done. Our next position is the Fowler's position. It is used to facilitate breathing, relieve distress, encourage drainage, and examine the head, neck, and chest. The patient lies on the back, as shown here. Head is elevated to one of three positions. The first one is the low position. The head is elevated at a 25-degree angle. The second is the semi-position. The head is at a 45-degree angle. And then the third is the high position, and the head is elevated at a 90-degree angle. The legs lie flat, but the knees are bent slightly. And you can use a drape or pillow on your patient. Our next position is the lictomy position. This position is used for vaginal exams, pap tests, urinary catheterization, cytoscopic exams, and surgery of the pelvic area. The patient is positioned on the back, as shown here. Knees are separated and flexed, and the feet are placed in stirrups. We obviously don't have stirrups here, but we have imaginary ones, as shown by our patient. The arms are at the sides, and the buttocks are at the lower end of the table, as you can see by our patient, and draping can be. Our next position is the dorsal recumbent position. This position is similar to the lictomy position, but the patient is on a table without stirrups. Feet are separated but flat on the table, the knees are bent, and draping can be done. Our next position is the Trendelenburg position. It aids in the circulation of blood to the head and brain and can be used for circulatory shock. The entire bed is elevated at the feet. As you can see here, our feet is elevated. The patient lies in the horizontal recumbent position, as our patient is in the horizontal recumbent position. And the patient's head is lower than the feet. As you can see, the head is lower than the feet. This is known as the jackknife position. It is used mainly for rectal surgery or examinations and for back surgery or treatment. The patient is in the prone position. The table is elevated at the center. As you can see, your table is elevated at the center. The head and chest are pointed down, as our patient's head and chest is pointed down. The legs are on the opposite end of the head and chest, as shown there. And the straps, normally you do use straps to hold the patient.
I feel bad.
These are slightly separated.
You can hear that on the video. You can't hear me on the video. I said, fuck.
Why?
Because it hurts.
Okay, well.
Let's.
Our next position is. Why?
No, you don't have to. You can trim it.
Oh.
Retarded.
Our next position.
No, stop. All right.
Our
Stop.
next.
No, stop.
Our next position is the lictomy. What is it?
Lictomy. It's lictomy, Brandon. All right. 5 second break. All right, ready?
The next position is the Trendelenburg position. It increases circulation of the blood in head to brain and can be used for circulatory shock.
Restart.
Entire bed is elevated at the feet.
Elevated at the feet.
Yeah.
You want me to float?